Thanks for joining us today. We will go ahead and get started with the webinar. My name is Emily Henry. I am from Oregon State University's Professional and Continuing Education Unit. And I have here today Dr. Emily Caffrey to talk with us as well about the ROS, a new kind of responder for radiological emergencies. So Emily let me start with a few housekeeping items. So the session is being recorded. Please feel free to ask any questions during the webinar via the chat box to the entire panel. So there's a chat box. There's also a question box. I'll be monitoring those throughout the webinar. So feel free to ask any questions throughout. We'll also have time at the end for questions, but if you have something relevant throughout, I can kind of pepper those questions in for Emily. And questions will be addressed at the end of the webinar. And then we will also send out a link to the recorded presentation via email within 48 hours of this. So if you need to watch the webinar again, or if anyone missed it, we'll have that option for folks as well. So welcome again to today's webinar. We're looking forward to sharing information with you. I can give you a little bit information about PACE to start with. So PACE, or Professional and Continuing Education here at Oregon State. We are the non-credit arm of the university. So we engage the community through educational opportunities for personal enrichment and professional development. We offer hundreds of courses and certificate programs that are open to the public, and they address educational, professional, and economic development goals for you and your organization. So we're really excited to be able to partner with our colleges and departments on campus to advance careers and foster personal development and benefit our communities. And so we are committed to bringing the best of Oregon State to people of all ages and industries, and we are excited to partner with the College of Engineering today to do just that. So a little bit about our agenda today. So I am going to introduce our speaker, Dr. Emily Caffrey, and she's going to talk to us about the ROS, a new kind of responder for radiological emergencies. We're also going to talk a little bit about a PACE course that we're anticipating on the ROS, and have some time for Q&A, talk a little bit about program benefits, and also share our contact information for you all for any sort of follow-up questions you may have. So I will go ahead and introduce Emily. So Dr. Emily Caffrey graduated in 2016 from Oregon State University with her PhD in radiation health physics. Her research included environmental dose response, dose assessment, and computational dosimetry methods. In addition to teaching online courses for Oregon State, she also teaches at the University of Alabama at Birmingham and is a health physics consultant with the Risk Assessment Corporation. So thank you so much, Emily, for joining us today. And so I will turn the presentation over to Emily to talk about the ROS today.
Great, thank you, Emily. I appreciate the introduction.
Sure.
Hang on a sec.
You know, maybe let me turn it back to me and I can go through the slides. Does that work okay?
Yeah, that's fine. Sorry.
Okay, perfect. Nope, sorry. There's always a little webinar fun, so. All right.
Perfect. Yes, you can start with the next slide. So, well, I'll start here. The ROS, so for those of you guys that don't know, the ROS is stands for Radiological Operations Support Specialist. So it's kind of a mouthful. Fortunately, that simplified to a nice, easy acronym, the ROS. This is a program that is managed and sponsored by FEMA, the Federal Emergency Management Association, as an element of its chemical, biological, radiological, nuclear, and explosive program. So it's, again, a big mouthful, but it is a federally sponsored program. It's not an Oregon State construct. The webinar that we're talking about, or the class that we're talking about today, is going to prepare you to be able to take the 40-hour official FEMA-sponsored course. And so what is a ROS? So the ROS program arose out of the September 11th attacks, excuse me, and, you know, in 2003, the Homeland Security Presidential Directive 5 brought together a bunch of interagency working groups to identify gaps in radiological and nuclear preparedness. And in 2008, they identified 15 planning scenarios, but 2 of those were specific to radiological incidents. One was the need to be prepared for a radiological dispersal device, or RDD. So that's where you have, it's a dirty bomb essentially, where you have conventional explosives that are incorporated with radioactive material. And then when they explode, they project contamination with that blast. The second example that they developed as part of this working group in 2008 was an improvised nuclear device, or IND. And so that's the small scale nuclear detonation at or near ground level. So that's, I mean, those are big accidents. And the idea was that in looking at these different scenarios, what came out of that was a gap in our response capability. So we have first responders, and we've got emergency responders, we've got, healthcare providers, and we've got all these different types of first responders. But what was really lacking, what became obvious was lacking, was somebody that could respond to a radiologic specific accident. The results of something like an RDD or an IND would be really far-reaching and unlike anything else that we've seen before, and it would really tax the current response capabilities and resources that are available. And so this ROS idea came together as a solution, a potential solution, one solution to that gap. So, ultimately the ROS is a radiation protection specialist that is trained and exercised to prepare for, respond to, and recover from any radiological or nuclear incident. Not necessarily just the 2 I've named, those were the 2 key ones that were identified, but anything where radiation is involved could also involve the ROS. There's a special emphasis that's placed on the skills, knowledge, and abilities required to help decision makers engaged in consequence management, as well as any terrorist incidents that may occur. Part of this course is going to prepare you to take the FEMA course, where you'll be taught empirically tested and proven methods by leading scientists from national laboratories and veteran emergency responders. The ROS are health physicists that come from state and local organizations. They could be your local RSO, radiation safety officer, excuse me. They could be hazmat or first responders currently, although they would have to be trained, because it's not just about emergency response, it's about coupling emergency response with radiological knowledge. And I should just say too that this concept, while sort of born out of September 11th and then this working group in 2008, it's only actually been tested. It's now in its 4th year of testing, so it's still a fairly new, program, and there's only a few ROS currently certified in, I think, like 18 states. So there's not even one per state yet. So, and they're working to get several hundred spread out across the country to ensure that they can, response happens quickly. Okay, so that's what a ROS is. So if you go to the next slide, who should become a ROS? Well, some ROS originate from state and local organizations where you have that knowledge of the incident command structure or emergency management capabilities. But it's somebody that has health physics specific knowledge as well. So we're trying to couple emergency response knowledge with health physics knowledge. These individuals are trained and verified to have the capacity to provide this actionable guidance. So it's not something where you're just gonna, run out and be a ROS. It's a process to learn all the bits and how they work together. Who should become a ROS? Well, you need to be able to rapidly deploy. Obviously, if there's an incident, speed of response is really important. You have to be able to communicate radiological issues to a non-technical audience. That's really important because a lot of times the firefighters on the scene or the first responders on the scene who are going into some of these damaged areas don't know anything about radiation, and it's your job to ensure their safety and ensure that they are used in the most effective way possible. You have to be able to provide concise, actionable guidance and recommendations. So I don't know if any of y'all are familiar with the PAGs, or Protective Action Guidelines, but essentially you have to distill hundreds of pages of guidance into, simple, concise, actionable bits of information that you can pass along. And then, if it wasn't already obvious, if an RDD or IND event has happened, you're going to be working long hours in difficult, austere environments, and you're not going to have good computational capabilities. The internet may not be available, and you may not have good communication. So those are all things that you're going to have to keep in mind. So if you are someone that can handle those things, and then you should consider becoming a ROS. So, okay, so that's the what, and that's the who. So when would you get deployed? I think I covered when would you get, if you go to the next slide. Thank you. I think I covered the when you would get deployed. So the two key events we're talking about are an RDD or an IND. But the other cool thing is that you would participate in state and local training exercises. And they also have, you can see at the top of this figure here, exposure rate. You can see vibrant response. So that was the name actually of a federal training exercise, and they've had a few of those. I can't remember how many, where you actually are working alongside, although you're not an agent of the federal government, you're working alongside the federal management system. And so it's key that you can integrate with that system. So you get deployed in those events, and you get deployed generally locally, although, depending on where people are needed, it may not be local. There are mutual aid requests that we anticipate that happening as well, where you get sent off to somewhere else to help farther away. But, in general, especially when we're talking about key cities and key population centers, that's generally where you'd be deployed. And that local knowledge is really important, because the federal government, while it has a lot of capabilities and a lot of resources that they can put at your disposal, they don't have that local knowledge that you would as a responder. Which kind of covers my next slide too. I'm jumping ahead of myself a little bit, which is, where does a ROS get deployed? Well, in your local area generally. So you're really working in the best interest of the state and local areas. So it's your community that you're involved in. And so if we just go to the last slide, I want to talk a little bit about why you should become a ROS. I mean, you get to participate in state and local emergency response drills, which, if you're like me, I think that sounds fun. You get to provide vital communication to first responders, and you get to help your community. Health physics is a really niche field. It's not really well known. This is a great area where you can find a useful niche to serve your community. The other cool thing is you get to use your knowledge. So Bill Irwin did he's one of the guys that's really been developing this program a lot. And he participated in a drill in Indiana. And, a couple of the things that he got to do that I thought were really cool were he created maps of dose rate zones for first responders. So, in the event of an IND type accident, there's going to be zones, and I apologize if this is morbid, but there's going to be zones where you aren't going to send your first responders that are just, you have a big red X. And then there are zones where you need to get first responders immediately, because those people need help immediately if they're going to survive. So those are the people that might suffer from acute radiation syndrome, but they're still savable if they get appropriate medical attention. So if you picture a map and you draw a map, and you would label these zones, and then first responders then know where to go. And the other thing is about drawing those zones is knowing where you can send first responders and how long you can send them there, and ensure their safety, because you don't want to add to the casualties. So, while it's slightly morbid, I think that's a really interesting and important aspect of being a ROS, and something that you'd be involved in helping do. The second thing that I thought was interesting was you would be developing diagnostic guidance for healthcare providers. So, healthcare providers aren't necessarily trained in the best way to respond to an accident and how to treat contaminated people, and in how to respond to people that have acute radiation syndrome. And so you would help develop those diagnostic procedures, and you'd help with triage. Because again, some people are going to need immediate medical assistance and some people are going to be able to wait. You would also be helping with just that communication to first responders and the health community. So I think that those are a couple of the really cool things about why you should consider becoming a ROS. This course that we're talking, that's going to be taught at OSU, is going to give you some an academic pathway towards becoming a ROS qualified person. It's going to give you that health physics foundation. It's going to give you that emergency response foundation. It's going to teach you about the federal emergency management response capabilities. It's going to teach you about those protective action guidelines and what they contain. It's going to synthesize all of this information into one course that will ultimately prepare you to take this advanced course taught by FEMA, where you'll actually get to participate in drills and practice your skills, and then you'll be able to take a test essentially where you can become a ROS certified person through FEMA. So this will prepare you to do that and become a ROS in your local area. And and of course, if any of you all are students or interested, this is a great thing to put on your resume. It's a great way to meet people and network and get involved in different areas of the federal government and your state and local agencies that you might not otherwise. So the course is not scheduled yet, but it's under development, but it's coming soon. And so we wanted to let you guys be the first to know that it's coming, and to get you guys excited about the potential for becoming a ROS in your area.
Great, and we have a few questions coming in too, Emily. So we have the first question. I recall something about a minimum level of competency, levels 1, 2, and 3, if I recall, based on professional experience. What was that incorporated into the standard? Thank you.
Yeah, so that's a great thing to bring up. So there are 3 levels of ROS. So type 1 is the highest or most advanced level of knowledge, and then type 3 is the lowest level of knowledge, and then type 2 is like somewhere in between. And there's a nice graphic online. If you Google radiological operations support specialist, there's a really nice table that actually outlines each quality, but I'll just give you a brief overview. So the type 3, or the lowest level, has some level of advanced training in radiological emergency response, but that's it. Type 2 is someone that has an undergrad degree in a health physics or radiation related field like health physics or nuclear engineering, or they're certified by the National Registry of Radiological Protection Technologists, or they have some kind of equivalent experience in that range. The type 1, or the highest level, has a graduate degree in the radiation related field, or they've passed part 1 of the ABHP exam, or they have equivalent experience. So those are the 3 levels. And then, within each level, there's a table that you can find online, and then it's got the 5 capabilities. So measurements and instrumentation, standards and requirements, hazard analysis and control, operations and procedures, and fundamentals and education. And then it tells you what level of knowledge you have to have in each of those areas to be a type 1, 2, or 3 ROS. So, that capability ranges from you're aware of it and you know it exists and what it means, all the way up to advanced, where you can perform that skill without any assistance.
Great. So we have a few questions coming in about the format of the course, so we can speak to that a little bit from what we currently know, because certainly it's still under development. So we have some questions about, is the course online? Is the course on site here in Oregon? Because we have people joining us from across the country. And then we had some folks interested in continuing education hours. for CHP recertification, and would that be offered as part of the program? So I don't know if you could speak to that a little bit, Emily.
Yeah, I'll do my best. So the course will be online. So, it's accessible even if you're not in Oregon. I'm actually not in Oregon. I'm in Alabama. So it will be accessible anywhere around the country. It will be recorded lectures and activities so that you can do it at your own pace, but there will be an instructor involved in the course. So there will be feedback like that. It's not a self-taught course. It's a course with an instructor. As for the second part of that question, the CHP exam. I am not entirely sure how you qualify continuing education credits for the CHP, but I'm sure that there is a way that we could get that qualified. So that is definitely something I'm going to write down to myself and look into, because I think it would be really great if you could get CECs for that.
Great. So a few other questions. So does the Ross course embed response guidelines and best practices from the document entitled The First 100 Minutes? I don't know if you know anything about that, Emily.
I don't. Is the person that asked that question, is that a federal guidance document? It's not. It does not explain any more details. So maybe if he wants to write in with any more details, we can follow up on that question. So let's see. Some folks asked about traveling and federal funding and that sort of thing. So since it's online, there wouldn't be any travel or lodging needs. If folks have any questions about funding for the course, they're welcome to call in and talk with our office here at PACE, and I'll provide that contact information at the end. If anyone needs to get anything certified through an employer for them to pay, or have any questions about how payments work in our office, we're happy to talk that through with anybody. Some folks have also asked for the link to the website about the course, and we will send that out with a follow-up email after this webinar. Our homepage is PACE, just PACE, .oregonstate.edu, and so you can find the course on there, but we'll send out a direct link after this recording. Okay, so it looks like they've sent along the document. It looks like it's a DHS government document through FEMA. Okay, I can send that along to you, Emily. I'm not sure of the details on that one. Yeah, I actually just looked it up, and
oh, perfect.
Yes, that would be incorporated. So protective action guides are another form of federal guidance, but yes, that for the first 100 minutes, that's a great example of something that we would definitely try to incorporate into the course. So anything like that, we would be incorporating into the course for sure. So I'm glad you brought that up. I hadn't seen that one before.
I'm so sorry, I was muted. So next question. Someone had some questions about the program currently being on hiatus with FEMA, the Ross program. I don't know if you know any details about that, or if it's currently on pause.
Not on pause to my knowledge. I spoke with a representative a couple days ago, and they are working right now on funding for the next leg of the program. And where they want to put their dollars, but as far as I know, it's not on pause.
Okay, perfect.
Oh, but the course, I'm sorry, talking about the course, like the FEMA course, like the actual qualification course, that is going to start being offered again in the fall. So if that's what you meant.
Okay, perfect. That may have been what they were referring to. Another question is, are there any Ross programs available? Is there anything that's really similar to this program that's being developed at Oregon State?
No, I mean, not to my knowledge. The only other similar program is the Ross itself, taught by FEMA. It's a totally new thing.
Great. So I think we're about through questions. We have a couple more. So Someone asked about the relationship between this program and the Master of Health Physics program at Oregon State. I don't know if you can speak to that a little bit.
Sure. So this will be offered, you know, I mean, it's through PACE, but obviously it's, I mean, I don't know if sponsored by is the right word, but coordinated with the Department of, sorry, it's not the Department of, it's the College of Nuclear Science and Engineering at OSU. So I imagine that there would be some crossover, although it's not, like Emily said at the beginning, it's not a credit course as part of that program, but it would definitely include components of that material.
Perfect. And we have another pretty specific one, so I will throw this one at you and see if you can translate maybe better than I can. So will LN 100 and LN 200 through the DOE's RSL be a requirement?
So for this class, there's no requirement to take this OSU prep class. I'm going to call it a prep class for the FEMA ROS qualification class, if that's what you mean. To take the FEMA ROS qualification class, I know that I believe there are some prerequisites, but I can't speak to what those are.
And I think that ties in a little bit with a couple of other questions that are asking about the testing for the course and the actual testing process through FEMA. So there are a few questions about, is that included with this? And is that test online, and some details of that. So no, it's not included, but maybe you can speak to that a little bit more as well.
Yeah, you know, I am not entirely familiar with all of the steps it takes to get through the FEMA course. I'm not FEMA ROS certified myself, so I haven't been through it. But this is the idea behind this class, is to prepare you to start down that path if it's something you're interested in. I know it's the one 40-hour class by FEMA, and then the testing and a few other, and then following up, continuing education and refresher courses through FEMA. But I can't speak to the specifics of how you get FEMA ROS certified at this point in time.
And I think this question is probably related to this as well, so this might be some good follow-up material that we can share with this group. But someone else is asking if this course could be a replacement to the FEMA ROS prerequisites, if it could be authorized as a pathway for that. So it sounds like that might still be a question that we would need to look into, but it's another good issue someone raised.
Yeah, I'm glad someone brought that up. That's definitely something we will look into, because I think that would be a really nice tie-in. But we have to work that out with the FEMA folks still. But I'm glad you brought that up.
Perfect. So thank you all so much for joining us today. If anyone has any other questions, we'll do a little wrap up and have a few more minutes for questions. As Emily said, this course is still in development, and so course dates will be coming soon. Everyone that's registered for this webinar, we have your contact information. You will be the first to hear about the program. We're going to also offer a special discount to everyone that joined us for this webinar as our first cohort for this program. So right now, course dates coming soon. We're planning for it to be about 40 hours of learning over the course of the program. That would include all assignments, assessments, readings, lectures, that sort of thing, and for it to be fully online. Here at Professional and Continuing Education, we do the vast majority of our courses online, so you're really tapping into state-of-the-art courses and technology in terms of online learning. And the course website is linked out in this webinar that you'll receive the recording and the link to the slides, but we'll also include the link to the webinar, to the course webpage as well as the webinar. And if you have any questions, we have our contact information down here. You're welcome to contact us at our PACE general contact information, and I've also included my Emily Henry and Dr. Emily Caffrey's contact information as well. And we appreciate, again, you all joining us today, and we look forward to you hopefully joining us in the future when we're able to offer this course. And is there anything else on your end, Emily?
No, I think you covered it. I appreciate the feedback and the questions. They're definitely things that we'll be taking into account when we develop as we develop the course. So thank you very much, everyone, for joining us.
Yes, thank you again. Have a great day.